Thank you. Question number 4. The county's Roundtree facility is undergoing a physical and philosophical overhaul where once completed, it will prioritize rehabilitative services while reducing the total number of beds for inmates. Do you believe this approach, with an emphasis on rehabilitation and education, will be more effective than traditional methods at reducing recidivism? Mr. Hart.
So the other candidates in this election have really been negative about our plan for the Roundtree facility. And I've been in on this plan from the beginning, and I want to tell you what we're doing, and then you guys make the decision on whether it's a good idea or a bad idea. We had a shuttered minimum level jail at Roundtree. It was falling down, windows were popping out, it was held up by a bunch of termites, and that's all that's there. And it had 270 minimum level beds, which means anybody could walk away from that facility at any time. It was essentially an honor farm. And so what we did is we applied to the state on a competitive grant, and the state just awarded us $25 million to renovate that facility and to harden it into a medium security jail. There's already one medium security jail out there that houses 115 men. And so what we're going to do is we're going to harden this minimum jail, take out the 270 beds, we're going to put in 64 beds. And we're going to use that facility as a long-term treatment, education, and programming facility for the prison realignment inmates that are staying with us for up to 12 years. Because of prison realignment, if somebody's convicted of a non-serious, non-sex, non-violent crime, they don't go to state prison, they go to county jail. And so far, the longest sentence we've received is 12 years. LA County's had it for up to 25 years, serving time in county jail. So we know this is a problem. Trying to house people long-term in a county jail environment is very difficult on staff, very difficult on the inmates, and difficult on the facility. So we needed to create something for these inmates who are staying with us for a long time. So we're building this facility. We're going to offer vocational training, substance abuse counseling. Everybody's going to graduate and get a GED who stays there for a long term. We know that 60% of our inmates don't have a high school diploma or a GED. So if somebody's staying with us for years at a time, they're going to go to class and get their GED. They're going to get domestic violence counseling if that's a problem for them. They're going to get some vocational training. They're going to leave with a California ID card and or a driver's license if they're eligible, and a social security card, so that when they leave that facility, they have some documents in their hand in order to be employable. We're also partnering with community-based organizations and nonprofit groups. We have about 27 contracts in place that when the long-term inmates leave our facility, we hand them off to these community-based organizations that are willing to help these people get transitional housing, get jobs, get signed up for Cabrillo, or get some other education. We believe that long-term treatment, long-term programming, long-term education is going to cut down on the recidivism level, which at statewide is 70%. We've reduced that number down to 66%, and we believe that with what we're going to do in that facility, we're going to bring that number down much lower than the 66% it is at now. Thank you.
Thank you. Mr. Kersley.
$25 million to retrofit an existing building or harden an existing building. I'm the one that closed the Roundtree facility. Why? Because out of human dignity and respect for the people that are in custody there, because they are human beings, regardless of how they've come across the law and wound up in custody, do not deserve to have a building fall down around them. They do not deserve to have window frames fall on them when they're asleep. I know this because I was the commander of Roundtree. I was the one that helped put up the boards that closed up that building. So, they're trying to put in 66 beds in a hardened facility to do the same things that were inherent to Roundtree in the first place. Roundtree offered vocational training. Roundtree offered people driver's licenses when they left to get them out, to make sure they got those licenses, to make sure they had their social security card. Domestic violence classes were held out there. Computer training to build resumes were being conducted out there. computer repair classes to give people, when they left, a skill that they could possibly do in their own living room, if they had to, in order to support themselves when they were released from custody. On top of that, some of those computers were turned over to low-income families whose kids had no access to computers. We turned those over. We often let inmates go off-site to computer classes put on by Cabrillo to further this endeavor. So these programs are already in place. These are nothing new. They're restarting them because they were stopped. However, these programs were in place with 150 plus inmates in that facility at any time. And all of these inmates were going to these classes, some multiple classes, some one, depending on what their sentence was. Also, at the same time, we had people who were free to come and go from that facility. Why? Because they had families they had to support. They had jobs. They had gainful employment. They parked their cars outside of the facility. In the morning, they got up, they got dressed, they left, they went to work. They came back in the evening, parked their car, put their jail uniforms back on, and they were inmates once again overnight. This was a program also in effect at Roundtree. So, yes, I am negative about what's going on because I think you can offer more services to more people with the money and with the starting up of all the programs that they're touting as new, which aren't. They're a rehash. So with that, please think about that because those were in place. They're taking $25 million that could actually have been used someplace else or a portion of it to rebuild that facility. Thank you.
Thank you, Mr. Wiley.
Well, I'm certainly not against these rehabilitative programs, and they have been in place for a long time, as Bob said. This is nothing new. It sounds wonderful and innovative, but these community agencies that are working with it, so the same agencies that are involved in the CAP program, and they're getting millions of dollars funneled to them to do these treatment programs. And some of them work and some of them don't. It's just, they're getting a lot of money, but there's really no monitoring how good of a job that these particular agencies do, and they're getting a heck of a lot of money for it. So, I question how effective that's going to be when we're talking about mostly recidivist offenders. The ideal situation would be the long-term people coming back to the county would serve time in the main jail, and then with the lower-end offenders could come go out to Roundtree. But this could have been done a lot better. It doesn't cost $25 million to build a high fence. I know a contractor, and he can verify that. They could have revamped this facility, repaired it, kept it at a high-capacity facility, hardened that facility, and used it for virtually the same purposes that they're using it now, and housed many more inmates. Then, what I would have done, or what I think would make a lot more sense, is to build an additional facility for mental health patients. Because mental health patients right now at the jail are the low end of the spectrum. They often have to be in isolation, so they're not treated well usually, and there's no place to put them. The mental health system is broken. In other states such as Washington, they have this program like they're putting in place in Santa Cruz that they have a judge dedicated to it, and mental health people, health officials, and law enforcement working together. But when you have people that can't be on the streets, and there are people like that, you need a place to put them. And this grant specifically called for the ability of the county to build a mental health facility. It made a heck of a lot more sense to maintain the high capacity of that Roundtree facility that we had, harden it, and put up a mental health facility. These are the kind of practical solutions that I'm looking at. I'm not adverse to these programs if they're monitored, but to just come up with something like this and just so we can pour money into these organizations, which is, I think, is what's going on, is a travesty to the community. It's a waste of taxpayers' money at large. Thank you.